let's try to understand our next question. Our next question is: a patient underwent gastrectomy, which vitamin replacement is basically required for this patient? Okay, so the options are vitamin A, vitamin C, vitamin D, and the vitamin B12. So to understand this question, you have to understand few things regarding the complication of gastrectomy. So obviously, gastrectomy is the one of the most important uh, operation that has been performed by the surgeons, and obviously its impact, it's a complication that is also huge. So among that, only we are going to understand the metabolic complication of the gastrectomy to solve this question. Okay, so before that, we have to understand the basic of iron absorption. So your iron basically absorbed through duodenum, right? Now, before absorption of the iron through the duodenum, what happens is that the ferric Fe3 plus form that has been transformed into ferrous form, that is your Fe2 plus, through the action of the hydrochloric acid in the stomach. Okay, now we are dealing with a patient with a gastrectomy. So in that patient, the stomach or the portion of the stomach already has been excised. So as a result of that, acid production is also going to be decreased. As a result of that, your conversion of Fe3 plus into Fe2 plus, that is also going to be decreased. So your iron absorption in that case, this is the number one cause. Number two cause is that sometime while doing the gastrectomy, we always try to bypass the duodenum. Okay, suppose we have already performed the Roux-en-Y or some loop procedure. So in that case, your duodenum is eventually bypassed. So as a result of that, iron absorption also going to be decreased in such cases. So as a result of this whole scenario, there is a iron deficiency, which iron is eventually much more important in the production of the hemoglobin, and there is a anemia, right? So this anemia due to iron absorption, decrease amount of the iron absorption, can be treated with a iron supplementation to the patient. Okay, so this anemia is going to be one of the most important or the most common metabolic abnormality that has been seen in the post gastrectomy patients. Now, another important cause of the anemia is eventually the vitamin B12 metabolism. Now you have to understand, for the absorption of the vitamin B12, typically that happens in the jejunum and the ileum, it basically requires intrinsic factor. Now this intrinsic factor eventually produced from the parietal cells of the stomach. So after the excision of the stomach, obviously these intrinsic factors are also going to be decreased. Now this as the intrinsic factors are going to be decreased, your vitamin B12 absorption is also going to be decreased, right? So that's why your anemia, especially megaloblastic anemia, has been also seen in such cases. So your long-term vitamin B12 supplementation with intrinsic factor supplementation, both are basically necessary in such cases. So next comes our calcium deficiency. So as a result of gastric resection, what happens is that there is a lots of the fat malabsorption that has been seen. So as a result of this fat malabsorption, what happens is that excessive amount of the fatty acid, that they will remain inside the lumen of the intestine. Now, as a result of that, they will eventually bind with the calcium, and they will eventually excrete it through the fecal matter. Now, while dealing with such patients, so they are eventually had less amount of the calcium absorption through the intestine. So they eventually got less absorption and calcium deficiency. Okay. Also, sometime blind loop syndrome, and there is excessive amount of the commensal flora. They are also going to be responsible for such case scenario. Okay. Now the problem is basically depending upon how much stomach has been resected. So that is going to be the determinant factor of the impact of the problem on the patient's life. Okay. So to treat such scenario, what we have to do is that we have to supplement the calcium in conjunction with a vitamin D. Because why vitamin D? Because the vitamin D is the fat soluble vitamin. So we have the 4 fat soluble vitamin, that is your A, D, E, K, right? Now, as there is a fat malabsorption, also your vitamin D absorption is also going to be decreased. Now, this vitamin D is eventually required for the increase of the calcium absorption from the stomach and the kidney as well. So, that's why your vitamin D supplementation is also necessary, along with all the fat soluble vitamin in that case. Okay. Hopefully, I'm able to make this concept clear for you guys, right? And especially your Billroth 2 and the Roux-en-Y reconstruction is the one. Then we have the weight loss. So this weight loss has been significantly seen typically in case of post-vagotomy or gastric resection status. So the causes are typically, number one is the malabsorption syndrome. Okay. So it's a in that case, you are able to found that there is an increased amount of the stool fat content in that case. Also, in case of post-gastrectomy status, the patient typically shows altered dietary intake, and that altered dietary intake eventually associated with a decreased caloric intake too, right? So in that cause, obviously your malabsorption is not going to be the main problem. Here you are able to find that your stool fecal content will be negative, but it is the most common cause of the weight loss, especially after the gastrectomy has been seen, and that is your altered dietary intake. Now you have to understand why this altered dietary intake is happening to the patient. It's because of the number one is that small stomach syndrome. So as a result of that, initially the patient's stomach was like that, right? So now after the operation, it basically goes somewhere into this. Okay. So the volume of the stomach basically goes down and decreases. So the capacity is also going to be decreased and the dietary intake as well. And your post-op gastroparesis, because you have somewhere able to injure the vagotomy or this pylorus action has been lost. As a result of that, the patient is much more often suffering of for the gastroparesis, and eventually patient basically even after taking small amount of the food, patient complains of like there is abdominal fullness typically in the upper abdomen. So as a result of that, patient is not able to take adequate amount of the food after that. Okay. And obviously your another important aspect is that there is a changes in the hormonal aspect. So there is a loss of ghrelin, which is eventually associated with the anorexia. Now the same exact mechanism is eventually used in case of bariatric surgery. Okay. But here it's a complication that we see. Now also, sometimes the patient eventually avoids specific kind of food because of the specific complication, like we have the dumping or diarrhea. So as a result of this dumping syndrome or the diarrhea, the patient eventually adopt few modification in their diet. Okay. So that will eventually associated with this altered dietary intake, and this is going to be the most common cause in that case. Now come back to the question. So a patient undergoing gastrectomy, what vitamin replacement is supposed to be needed? Your vitamin A, yes, it is needed. It is needed, but not that much essential. But the specific vitamin that is eventually needed in some patient is that your vitamin B12, because your anemia is the most common. Anemia is the most common cause, most common metabolic abnormality that has been seen in such cases, and this metabolic abnormality eventually happened due to iron deficiency or vitamin B12. Also vitamin D has been seen, but as your anemia is the most common complication, so we have to go for vitamin B12. This is going to be your answer. Okay. Now let's take another question regarding the same topic, which is your post-gastrectomy patient. So the patient presented with a complete complaint of lower limb weakness. What is likely to be the cause of this? So here we are also dealing with a post-gastrectomy status, right? So your B3 and the B6 deficiency has not been seen with the post-gastrectomy metabolic syndrome. Which has been seen is that your vitamin B12 deficiency. Now this lower limb weakness, this is typically common features with the B12 as well as folate, but it is much more consistent to go with this option, right? Now let's try to elaborate the role of the vitamin B12 as well. So it's basically required for DNA synthesis, right? And by forming the DNA synthesis, it's eventually the main function is that myelin sheath formation for the nervous system. Okay, myelin sheath. So proper functioning of the red blood cell. As a result of that, in case of vitamin B12 deficiency, we are able to see both of these clinical features as a result of megaloblastic anemia, right? As a result of megaloblastic anemia and as a result of neurodegenerative disorder, right? Neurodegenerative disorder, because there is a less amount of the myelin formation in case of nervous system has been seen, right? So in case of neurodegenerative disorder, your typical features would be peripheral neuropathy and your lower limb weakness. Patient will typically complain of this. And there is a typical features of the paresthesia. Paresthesia. So this is basically known as a subacute combined degeneration of the spinal cord. This clinical scenario has been known as the subacute combined degeneration of spinal cord. And also we have the hematological manifestation, that is your anemia, which is your megaloblastic anemia, typically seen in such patient. Okay, why? I have already mentioned in my discussion, like there is an intrinsic factor that is going to be secreted from the parietal cell, which is eventually get resected in the gastrectomy. As a result of that, your intrinsic factor is going to be less or lost. So your vitamin B12 is also not going to be absorbed through the distal part of the small intestine, because the complex vitamin B12 and the intrinsic factor, that complex is basically getting absorbed through the intestine. Okay. Now, over the time, the patient eventually develops vitamin B12 deficiency in case of post-gastrectomy scenario, and these are the two basic clinical features. Okay. So, hopefully this will